Good evening and welcome as we let people join our wonderful, I'm going to call it a roundtable this evening. Please do us a favor and put after your name in the chat, please indicate where you are located, the region of the country, the city. That would be great. It helps us get a picture of who all we have joining us, guests from across the country. And we're going to get started in about 2 to 3 more minutes. For any new people joining us, please do put along with your name in the chat, where you are in city, region of this country. And I think we are about ready to start. So nice to see so many people from Denver joining this Denver team. We have obviously lots of people from the Bay Area. Um, we are safe and sound for anyone who was concerned. No tsunami hit us today. We had our tsunami warnings. There was a big quake up in Northern California, hoping that there are no injuries that have been reported so far. We have all been on high alert, or we were on high alert for about an hour following the series of earthquakes. And fortunately, there was no tsunami, but you know, we do have a great emergency system in place, fortunately. But that just, uh, we are very happy that we have a system that will keep us safe should we ever have something like that occur. So welcome and good evening. This is our final webinar for our 10th season of the Touro University, California Social Justice and Public Health Speaker Series, hosted by the Public Health Program. My name is Gail Cummings, and I am the director of the Public Health Program. And I am joined by Dr. Deirdre Wilson, who serves as the chair of the Community Action for Health Concentration in the Master of Public Health Program here at Touro University, California. And together, we have been the host of the Social Justice and Public Series for the last 10 years. Before we begin today's seminar, we want to make sure that we pause and reflect that regardless of where we are all located, whether we are in Denver, Colorado, or in Vallejo, or where I'm sitting in Hercules, California, we sit on the ancestral and unceded territory. The city of Vallejo, which is the home of Touro University of California, exists on the Confederate villages of the Lejeune, the Karken, and the Patwin peoples, who are the traditional stewards of this land. We also pause to remember that our country is built on the labor of enslaved people who were kidnapped and brought to the U.S. from the African continent, and we recognize the continued contributions of our survivors, and we acknowledge all immigrant labor, including voluntary and involuntary, trafficked, forced, and undocumented peoples who have contributed to building this country and continue to be integral in our labor force. And as we all do this work, it's our collective responsibility to critically understand these histories, and to understand the need to repair the harm that has impacted generations and honor and protect and sustain this land. Thank you all so much for being here and your continued dedication to advancing health equity. If this is your first time joining us, the purpose of this seminar series is to provide upstream discussions around social justice and public health for students in our MPH programs and professions in public health, medicine, education, pharmacy, and nursing degree programs, as well as for our community and our global partners. Each year, we focus on a different topic, and we've been so excited this year with our speakers focused on a topic which is relatively new to us in the public health arena, which is the commercial and economic drivers of health and justice. So over the course of the last 4 previous sessions, we've heard from leading experts across diverse fields of health policy, health history, public health, and social justice who have really helped us understand the current commercial and corporate landscape with discussions centered around how it has developed, been deployed, and the ways that it has really undermined social justice and health equity. And fortunately, looking at strategies for a way forward, and we'll continue to do that today. We've heard from the industries, including folks from the food industry, issues around the food industry, tobacco, alcohol, and the pharmaceutical industries, and how all of those industries have impacted social justice and health. Today, we are excited to welcome an amazing multidisciplinary team from Denver, Colorado, who will help us understand the prison industrial complex as a commercial determinant and driver of health. And before I turn it over to Dr. Wilson, we want to send our condolences to Congressman Justin Pearson, who was planning to be our final speaker in the series next week. He, due to a tragic family loss, he will not be presenting next week. And while we hope to have him back at some point, to provide his talk about the fossil fuel industry as a commercial determinant, we want to make sure that he knows that we are keeping him and his family lifted in prayer at this time. Congressman Justin Pearson is a congressman from Tennessee. And with that, I will turn it over to Dr. Wilson.
Hello, everyone, and good evening. I just want to let everyone know that the public health program at Touro University, California, offers a master's degree in public health to students seeking the independent MPH degree, as well as students seeking dual degrees in public health and medicine across 3 concentrations, including global health, community action for health, and health equity and criminal justice, of which we are currently the only accredited MPH program to focus on the impacts of mass incarceration and justice involvement as a social determinant of health. So with that, I'd like to also invite our current students to please direct you to Canvas to complete your assignments. I'd also like to remind you that today's webinar, we are discussing the prison industrial complex. And we will have a brief Q&A at the conclusion of our discussion. So please write those questions down and put them in the Q&A chat function in Zoom. And we will go through those questions at the conclusion of our presentation. For those of you who are interested in continuing education opportunities, we have CME credits available. I've posted the information in the chat for those of you who are interested in both the CME, but also we have continuing education opportunities to receive a badge or micro-credential through Touro University. Those links will also be in the chat. Now, I'd like to introduce this dynamic team that will give us great information and an entree into the world of the prison industrial complex as a commercial determinant. I'd like to first introduce Michael Clifton. After serving 25 years in prison, Michael's life was transformed when his sentence was commuted in 2023. Now, as a Remerge program manager, he uses his lived experience to mentor and support justice-impacted individuals in their journey back to society. We also have Stephen Hartnett, who's a professor at the University of Colorado, Denver, director of the College and Prison Program, and longtime advocate for prison reform. He's been teaching, writing, and protesting America's prison system for over 35 years. And last but not least, Carol Peoples, executive director and founder of Remerge, a nonprofit supporting people impacted by incarceration through reentry programs such as housing, public health collaborations, and such. Carol has been a leader in efforts to break down barriers for returning citizens. So, with that, I'd like to introduce this dynamic team. Thank you so much for joining us today.
Good evening, everyone. Welcome. Greetings from Denver, Colorado. Deirdre and Gail, just give me a quick thumbs up if you can see the slides and if you can hear us okay. All right. Well, good evening, everybody. I'm Stephen Hartnett, professor here at University of Colorado in Denver, founder of our college and prison program. It's a terrific honor to get to be with you all today. And before we go on, I want to just briefly have some introductions from my friends and colleagues here. Michael, you first.
Yes, hi everyone. Good evening. Great to be here. Just to share a little bit about my experience, my lived experience. The arts played a really big role in my transformation after spending 5 years in solitary confinement. We did theater as well as podcasts. We did a podcast called the program was called DUPI, and it's DUPI stood for University of Denver Prison Arts Initiatives, and I'm a really big advocate for advocating for these type of programs, and helping people rehabilitate and transform their lives in the system. It's really great to be here.
Carol.
And hi, everyone. I'm Carol Peoples. I'm really delighted to be here. I'm a former teacher. I walked into a prison in Salida, Colorado in 1999. And ever since then, I've been really interested in trying to do what I can to help people come out of incarceration, do my part.
All right, so that's Michael, that's Carol, I'm Stephen. Our talk is called The Prison Industrial Complex as a Determinant of Health. And before we go on, I want to ask you all to look at the beautiful piece of art there on the left. And since you are public health students and scholars, I thought you'd appreciate the fact that that is a sculpture made from a bar of soap. And the coloring on the soap is made from shoe polish and the ink broken out of a pen. And I like to always start with that image because it shows you the tenacity and the creativity of the people we lock behind bars. And they're capable of making art. They're capable of terrific, wonderful things. And so everything we say to you tonight about the prison industrial complex as a determinant of health comes from this place of respect and solidarity and wanting to get visionary artists like Arthur out of prison and back within our communities. Now, before we launch into the talk, just briefly want to say thanks to Gail. That was a beautiful introduction, Gail. Really well done. Thank you, Deirdre, for all the great work you do with the students. Thank you to Sharon, Michael, and all of the fantastic students at Touro. Thank you to everyone from Denver who's logged in. And the piece of art there on the top, also wanted to share that with you. It's important to remember that the folks we work with and live with refer to the prison industrial complex as the system. And this art depicts what the system feels like. It feels like a faceless, masked monster coming for your family and throwing your loved ones into cages. It's really a remarkable painting, isn't it, to kind of depict the sense of fear and trauma and the violence of the system that we're here to talk to you about tonight. So in terms of the overview of the talk, we're going to do four things. I'm going to map for you the prison industrial complex. Then I'll talk for a little while about the prison industrial complex and health and aging as a public health crisis. Then Carol and Michael are going to talk to you about the prison industrial complex and COVID. And then we hope we can have a robust conversation. And I just put for you there on the right the cover of one of the magazines that we do out here in Denver called Capture Words, Free Thoughts. And this is our quarantine edition. Almost 100 pages of poetry, prose, and arguments from people incarcerated during the COVID lockdown. And so if you want to get that firsthand personal testimony, you can find this for free on the web. I encourage you to check out the work we do. All right, so part one of our talk. What is the prison industrial complex? I'm sure you've all heard the term. It often sounds conspiratorial. It sounds kind of strange and complicated. So let's try to break it down. First thing to know, the Cold War military industrial complex is where we get the title for the prison industrial complex. And so what was the military industrial complex? It was a line out of President Eisenhower's farewell address from January 17th, 1961. For those of you who are history buffs, by the way, we could talk later about how Eisenhower created the very thing he's here complaining about. But what's interesting here is he says it's a conjunction of an immense military establishment and a large arms industry, which exerts a total influence. Now, notice the phrases here: economic, political, even spiritual, felt in every city, every state house, every office of the federal government. Now, just for fun, if you take out military and put prison in the sentence, that's the prison industrial complex, this immense conjunction of forces which have economic, political, and even spiritual impact upon our nation. So what does that look like? Let's break it down. Now, this is a complicated slide. I'll give you a minute to just kind of look at it. This comes to us from the Prison Policy Initiative. And it shows us we have over 1 million people in state prisons. We have over 500,000 people in local jails, over 200,000 people in federal prisons and jails. And then that sidebar on the right gives you youth detention, immigration detention. What's significant about this is to show you that we have around 1.89 million people locked up in some capacity, and this number fluctuates. So sometimes you'll hear people say around 2 million. The key thing to know is these are 2 million people who are not paying taxes. They are not voting. They're not taking care of their children because we have forcibly removed them from our communities. So the first thing to realize from looking at the graph, those numbers are lives. Those are fathers, sons, daughters, mothers, partners, workers, employees, students. It's a terrible, terrible damage to democracy to take 2 million people and lock them away. So the first thing to know is the prison industrial complex is depriving our neighborhoods, depriving our democracy of these 2 million neighbors who are locked up. Now, it's also important, this slide shows you probation and parole in the United States. Now, this is 2021. The reason it's not 2024 is because the Bureau of Justice Statistics is crushing this national data. So when they release the new reports, it's always a year or two late. But so this is the best one I could share with you. The thing to know here is they're reporting, the Bureau of Justice Statistics is reporting 3.74 million people on probation or parole. So in this slide, we're looking at 2 million people locked up in prisons, jails, immigration detention centers. And in this slide, we're looking at approaching 4 million people on probation or parole. So now we're talking about almost 6 million people under some form of surveillance, control from the state. So this is an immense population of humans that we're locking up. Now, sometimes people will say that prison industrial complex is a logical response to an explosion of crime. That's not true. If you look at this slide, this is showing you incarcerated Americans from 1920 to 2008. This is data that comes to us from the Social Justice Policy Institute. And if you look at 1971, that's when Richard Nixon declared his war on drugs. And then if you look at 1984, that's when you get the Sentencing Reform Act. Now, that's a funny thing. It wasn't actually a reform act. That's the law that passed down mandatory minimum sentences. In California, you all called it 3 strikes and you're out. These were policies that put more people in prison. So what the graph is showing you, I just told you how we have 6 million people under some form of state supervision, control, incarceration. That number blew up on that graph because of policy, not because of an explosion in crime, because of policy. Now, it's really funny. Look at this. This chart is showing you that in the same way the prison population can explode from policy, it can decline because of policy. So this is showing you prison population trends since 2008. And I put a red arrow there to direct you to California. You can see that California is down 22%. Now, there has not been a corresponding decline in crime in California of 22%, but the prison population has declined by 22%. Look in the pink on the bottom. You can see that Arizona's prison population has gone up 17%. There has not been a 17% increase in crime. So what this chart is showing you is that who we send to prison, how long people stay in prison, when we let people out of prison, has no relationship to what the TV tells you is crime on the street. It's all driven by policy. want to say that again, because this is really kind of not how you think about the prison industrial complex. It is an invention driven by policy. Now, I want you to think of it as a wheel of networked forces. Look in the yellow box there. This is from a report called The Economic Burden of Incarceration in the United States. And this report, this comes to us from Florida State. They report $80 billion per year, and that's just for prisons and jails. Think about that number, $80 billion for prisons and jails. But now let's look at the little wheel of interlocking forces here. Think of the legal class. Everyone you know who's a lawyer, everyone whose dad or mom is a lawyer, all of your friends who are lawyers. The legal class exists because of the prison industrial complex. Think of the police and the amount of money we spend militarizing the police, funding the police, training the police. Think of all the money the legal class spends litigating complaints against the police. Go to the next part, to the media. Think of how American popular culture hinges on the prison industrial complex. Think of CSI Las Vegas, CSI New York, CSI Miami. Think of all the ridiculous shows on American popular culture about the prison industrial complex. And now think of the revenue for advertising for those shows, the salaries for the actors and the artists working on those shows. When you start to add all this up, you're starting, I hope, to get the idea that the prison industrial complex is this vast network of opportunity in which you can participate in the system. And this takes us to what we call carceral capitalists. Think, for example, we said there's 6 million people under state supervision or control. Michael, you were in a long time, you know this. How many guys did you see eating Campbell's soup when they were in prison?
Everybody's in Campbell soup. The basics, canteen, yes.
Ramen noodles, Campbell's soup, toilet paper, tissue paper. That's all being sold in canteens in prisons. That's what it means when you hear the phrase carceral capitalists. These are folks making money by selling goods in prison. And the final part of the wheel there, the political class. Think of all the politicians campaigning on getting tough on crime. Think of how their persona, their entire political legacy is based on getting tough on crime, putting people behind bars. When you add the wheel here, all the elements of the wheel here, what you see is a system of interlocking opportunity. Now, it's not a conspiracy. This is just how capitalism works. The consequence, the poor go to prison and racism is institutionalized. And what I mean by that is it's the poor who don't have the money to hire the lawyers, so they're getting public defenders, so they're plea bargaining and going into prison. It's their families sending them money into commissary to buy the Campbell soup, the ramen noodles, and so on. So the entire system works to disenfranchise poor people. And this obviously overlaps, as Gail mentioned in her introduction, with the legacies of slavery, the histories of institutionalized racism in America. At the same time, politicians campaign on being tough on crime, the media profits at every step, the police become militarized, neighbors become enemies, and as all of this starts to add up, it means imprisonment is incentivized. Think about that. Prison is incentivized. Here we are in the beautiful offices of Emerge, where Carol does this miraculous work, helping people on the streets, and she's doing it, whole office held together by love and duct tape. On the other hand, we've got the entire legal class of America that has a vested interest in keeping imprisonment rolling. Think of all of your friends and neighbors who would love to see the abolishment of prison. And then compare that to the $80 billion that we spend on prisons and jails. And so you see that what happens here is as imprisonment is incentivized, it makes it even harder for activists like us to do the good work we want to do because our work is not incentivized. The end result is that democracy is compromised. This, of course, leads then to catastrophic consequences for public health. So let's jump down now. Let's go to part 2 of the talk. Prison as a driver of public health, and we're going to do a focus on aging. I'm hoping that many of you are out marching, that you're going to rallies, that you're going to protests, and when you do, you'll see this sign, prison health is public health. Hold that thought as we move forward in our talk. Now, I'm going to ask you to look at this slide carefully. This comes to us from our allies and our colleagues, the Vera Institute of Justice. Up in the left, you see data about HIV and AIDS. And next to that, you see common STDs, both of which have higher rates in prison than on the streets. Look on the right there, where diagnosable substance use disorders, higher in prison than on the streets. Look at serious mental illness in jails beneath that, higher in prisons and jails than on the streets. What this slide is showing you, I know in public health, you often use the phrase concentrated disadvantage. So what this slide is showing you is that prisons are the epicenter of concentrated disadvantage for issues of public health, all across the board: drugs, alcohol, STD, HIV, mental illness, you name it. So prisons are these gathering places of collected inequality. Now, just to give you a brief, Michael said he loved working with the arts in prison, so I wanted to throw a poem at you real quick. This is a piece from Brian Anderson describing his struggles with mental health in prison. I think I'm an alien. I think I'm from a different planet. I don't belong here, so stop acting like you know me. We are two different species. Stop telling me your lies. Stop showing me your style. I don't care no more. I'm just waiting for my spaceship to come take me out of this world. And it goes on and on and on from there. Now, Brian is a regular correspondent to our magazine, Capture Words, Free Thoughts, and Brian has been very forthcoming about his struggle with schizophrenia. It's schizophrenia that got him kicked out of high school. It's schizophrenia that led him to prison. It's schizophrenia that he's now writing poetry about to try to get control of it. And so you all are students and scholars of public health. Just imagine the agony of being in prison with schizophrenia. So think just about the trauma, the pain that Brian and folks like Brian suffer through. Now, before we talk about the aging and health crisis, we've got to also remember that prisons are themselves detriments to public health. I'll let you read the slide here. What the slide is showing you is that just going to prison shortens your life. So I hope you're starting to get the narrative here, right? It's concentrated disadvantage around public health funneled into prisons, then the prisons themselves are detriments to public health. So prisons have become these kind of catching places, this total damaged health system on display in prisons. Now, let's talk about aging, because this is where it gets really complicated. Here's a headline from The Nation. By 2030, 1 in 3 U.S. prisoners will be over 50. You're all public health scholars. You know how this works, right? The older you get, everything gets harder. I know this from my own life. It just gets harder and harder.
Oh, look at me.
We're all wearing glasses. We're all taking more pain medications. Your sleep is interrupted. Your mental health gets tough. The older you get, the more health care you need. So what does it mean when we have a system of concentrated disadvantage? We call it prison. And now the prisons are aging. And look at the photo on your left here. If you think about your favorite crime show, the latest crazy film you've seen, think about how much this plays into American hip hop and rap music. And look at the gentleman on the left, the antithesis of everything you've ever been taught about the prison population in America. And I can tell you, I'm in prisons in Colorado every week. And as I walk across the yard of those facilities, I see this gentleman, people behind bars with a walking cane, with a wheelchair, maybe an oxygen tank. You can see this, the aging crisis behind prisons. And so one thing to realize is that prisons are not what you're seeing on the TV. It's not gang violence. It's not, monsters lifting weights. No, it's senior citizens trying to make it to the chow hall on time while walking with a cane. Now, thankfully, this is starting to become the topic of public news. Here's a story on your left from the Institute for Public Health, story on the bottom left from NPR, story on the right from the National Institutes of Corrections. So aging in prisons is becoming a really significant next phase in how we think about the work we do. And I'm really hoping that some of you students online today will consider this a potential career choice for you to go into this question of how to address the health crisis and particularly the aging crisis in America's prisons. Now, I bet a lot of you on this line also think internationally. And so I wanted to give you just the cover of this book. This comes to us from the London-based Institute for Crime and Justice Policy Research, showing you that the aging crisis in prisons is international. And if you want to see more about this, you can go to Amnesty International, Human Rights Watch, the Penal Reform International. A lot of our colleagues are working on this issue. So I want you to think about prisons as collective disadvantage, facing a health crisis in general, magnified through the aging, and then taking that global. That begins to express for us the extent of this crisis. Now, this slide is complicated, so I'll let you kind of read through this slide slowly. The main thing is to look at the image where the guard's face has been removed, indicating that we are facing nationally a crisis in prison staffing. On the left there, the data says in Colorado, since COVID, we've had a 40% staffing reduction. In Florida, you can see there in the middle paragraph, 85,000 shifts were left unfulfilled. Let's try to humanize that. That means 85,000 times that someone was not allowed to visit with a doctor, or to visit with their lawyer, or to visit with their family, or just to go to the library or go to the gym. So these staffing shortages are a critical part of how we think about the prison industrial complex. And it shows you one of the weird ironies of the system. We're spending $80 billion on prisons and jails, but we don't have enough guards to get folks out of their cell to go see a doctor. So the staffing crisis is a crucial part of what's making the health crisis in prisons as bad as it is. Now, this is where we're going to really get into the nuts and bolts. You all are students and scholars of public health, so you know that public health hinges on trust. It hinges on cooperation. It hinges on respect. These are hard things to find in a prison system. And so Tina Mashi there, the scholar listed in the source, has written a great article about palliative and end of care services in prison. And what she argues is that it's virtually impossible to get good palliative care in prison because of the issues there highlighted in red. Custody versus care, mistrust between correctional staff, safety issues, et cetera, et cetera. So think of how hard it is for you to do the work that you do as public health scholars and students, and then imagine how hard it would be to do that operating behind bars where there's very little trust, very little respect. That gives you a sense of how hard it is to do public health in prisons. Now, luckily, as we always do as activists and community members, we're responding. We're trying to fix this crisis. I work with a group in the top left called Just Care. It's a group out of Penn State, also based here in Denver with the group Klein Bundle, trying to bring palliative care into prison so that the aging prison population can get health care. Remerge, Carol's group, same thing, trying to get into the prisons and working on the streets to provide health care. The Humane Prison Hospice Project and the COCHS, those are both out of California. So those are local groups that you all, as scholars and students, I think most of you are based in California, these would be your local entities if you wanted to work with them to try to address this crisis of aging and health within America's prison system. All right, so that lays out, we've talked now about what's the overarching system, this thing called the prison industrial complex. Then we've focused it to say, what does the health crisis look like and how does aging impact it? And now we're going to focus it even more, and Carol and Michael are going to talk to you about the question of COVID based on work they did in COVID. So let's switch seats. Michael, Carol, one of you get in the middle and you take it from here.
Okay.
All right, go, Carol.
Hang on.
Okay.
Come
there
get
you-
closer. Yeah.
Yes.
So we're having a hard time. Hi, everyone. There's a camera right here, but we're trying to look at you as well. So if our eyes are darting around, forgive us, please. Thank you so much for this opportunity to be here in your classroom, your virtual classroom tonight. I love Stephen. He's just knows so much about so much. You got the big macro picture, and now we're going to go, as he said, we're going to really focus down micro. This is, I'll tell you a little bit about Remerge. It's a nonprofit I founded. We've been around since about 2015. We were a nonprofit in 2017, and the whole mission is just to reduce recidivism. So we work, think of this huge system that has created this problem, but then we're at the tail end of it. Well, what do we do with people who come out of incarceration? And the failure rate is huge. It was as high as 50% within 3 years. Sometimes it dips down, but you never know because they'll stop doing technicals or whatever, but it's high. You still have a lot of people fail to succeed in the community. And that's what Remerge is all about. I put a screenshot of a reentry focused website, our hub. It's a public service resource website on the bottom right here of the slide, just so you see that's what I started with. That was my passion on why I wanted to put Remerge out there. But then we've started adding programs, and one of them is this program we call House. It's an acronym, but we targeted people who were sitting inside our prisons, the aging. They're all aging, and they're all like disabled, and they all have a sex offense. So they had an indeterminate sentence, and they couldn't get out. In Colorado, the situation was such that, the parole's not going to let someone out unless they have some place to come to and address with an indeterminate sentence. So they were sitting in our prison for years. Some of our clients were in 5 or 6 years, and which is an astounding cost, $56,000 average per person. So we targeted that population with a grant that we wrote a couple of years ago. This is our first cohort that you see in the top left, sitting around this table in this room on a Friday morning. We have drop-in every Friday. We'll have one tomorrow morning. We're doing a Christmas program, and we're all making Christmas stockings. It's going to be so fun. But it's a way to create those pro-social supports that people need after being incarcerated for so long. One of our clients was incarcerated for 49 years, which is just an astounding thing to see, but also wonderful to see him thrive. Our program, I threw in the slide of showing the guys with the groceries in front of them. Why? Because we, with this program, are leasing people up with landlords before they get out of prison. It's a pilot. We don't know of anyone else who's doing this. And in that apartment that they come out to, they will find food in their cabinets, because we bought the food too, and along with the furniture. So it's a fully furnished apartment with food in it, and we get milk and eggs on the way home. And then it also includes some public policy work. On the bottom left, I wanted you to see all of us, and this is all the staff, a couple of our board members, treatment providers for people with a sex offense conviction, and a couple of our landlords. We went to our city council and did a presentation this fall on what it means, the barriers of a criminal conviction for housing. And specifically in this case, we're talking about people with a sex offense. It truly takes a village to do reentry in the community. And I hope this slide shows you a little bit about that. So along the way, we picked up a contract with the Department of Public Health and Environment and to do a COVID-19 listening tour. And I met this young man sitting beside me, and Michael Clifton, and he's going to take it from here and tell you more about the tour and his story.
Definitely. Thank you, Carol. I am one of the program managers here at Remerge, and I lead our COVID-19 listening tour. So we're going to talk about that. But let me share a little bit about how I got here. 26 years ago, at the young age of 19, I was arrested and sentenced to 98 years in the Colorado Department of Corrections. I served 24 years in prison before I was granted clemency in 2023. Excuse me. In 2020, I was housed at Sterling Correctional Facility, and that was the site of the largest COVID-19 outbreak. We all remember the COVID-19 lockdowns and how isolating and unsettling they were. But for those of us incarcerated, the lockdowns were unimaginable. Lockdowns for those incarcerated meant no programs, no recreation, no phone calls, and no visitation, complete isolation. For me, it reminded me of my time in solitary confinement. And this was a practice that Colorado has deemed inhumane and was abolished in 2017. For Remerge, we created a documentary for our COVID-19 listening tour, and the documentary was called Beyond Bars, a guide to navigating COVID-19 and the vaccines. And we want to just share with you some of the experiences from the participant from the focus groups.
It was right around the time that it first started. It was all over the news, and programs and visiting was getting shut down.
There was a remarkable lack of communications. The officers told us nothing. It was just a real stressful situation at the time.
Experienced a complete total facility lockdown. We were told about it, not from any of the staff members, but we heard about it over the television news stations.
And we were seeing, like cases start to break out. It was the cases in China starting to break out, and then cases just starting to break out in different areas of the world. And like first cases coming into the United States, which were really crazy. It was a scenario where somebody in the pod would cough and everybody would be like, whoa, like, and it's kind of like, people were joking about it at first. Then like, as it started getting more and more and more serious, everybody was like, kind of really starting to get freaked out. People were like, it got to the point where we were all just like huddled around the TV, like really looking for any kind of information we could have.
So Remerge launched our COVID-19 listening tour in the winter of 2023, and we were funded by the Colorado Department of Public Health and Environment. And we wanted to just listen to those who were formerly incarcerated. Unfortunately, we were unable to include the voices of those individuals who are still incarcerated, but their stories are deeply connected to this work. We also wanted to understand vaccine hesitancy and hopefully inform future policy in the event of another pandemic. The woman to the left in the picture, Robin, she was also incarcerated for 20 plus years. And she spoke about her biggest impact during the COVID-19 pandemic being the decline in her mental health, the loss of programming. A lot of people rely on those things for rehabilitation. They rely on those things to make it through and complete their sentence. And when those things were taken away, their mental health really, really declined.
So just to recap the tour, we knew we wanted to talk to the folks who were incarcerated around those dates of March 2020 to May 2023, the kind of the start and end of the pandemic. We wanted statewide outreach. The first thing to do in the office was educate ourselves and start creating educational materials. Michael created our own brochures and flyers, and then started working on establishing the connections with community partners. We targeted halfway houses because we knew that was where people would be transitioning out of the prison into, and then a couple parole offices as well. Tons of calls and emails just to make that happen. And then Michael got started doing 30 focus groups around the state in 20 different locations, and kind of meeting people when they're available. So a lot of times that was at night after people got back to the house after their day jobs.
Out the gate, some of our challenges was reaching the vulnerable population. So as Carol said, we went to the halfway houses, we engaged them, and we had to just understand and listen to them before we really got into the second part of our focus groups, was really the information and the education part. Trust and distrust. Getting into the halfway houses, I was formerly incarcerated. I was on parole, so thankfully we merged, had a great relationships in the community, and I was able to get in. As far as the participants, they were a little bit hesitant when we started our focus groups, but when I shared with them that I too was formerly incarcerated and experienced the entire pandemic, they did seem to open up. And we learned about the misinformation and the disinformation and how that came about. As Stephen talked about, the healthcare system, if individuals aren't receiving adequate healthcare before a pandemic, they're not going to trust and believe the medical staff or administration during a pandemic, or believe that they have their best interests at heart. And this led to vaccine hesitancy. But the second part of our focus group was to provide them with that educational material. And so we had the brochure, and part of that brochure was addressing some of the concerns and questions that people had. One of the biggest ones was people thinking that the vaccines would alter their DNA. The demographics, we spoke to 254 individuals, 206 men and 48 women. 167 of the men were vaccinated and 41 women were vaccinated. Kevin, up in the picture to the left, you've seen him earlier in the video. He was really great, and we knew we had to pull him to the side to be a part of the documentary. And then Monique at the bottom, she shared with us that she did not get vaccinated during the pandemic while she was incarcerated because she just didn't have enough information. But she did get vaccinated after she got out, and speaking with her doctor and being able to do her research. So I think that was really key in her getting vaccinated and understanding that.
So we heard a lot about vaccines, reasons for, reasons against, reasons for. I got to tell you, I'll draw your eyes down to the bottom of the slide because that's Kevin again. We just really, both of us really adored him. But his response about why he got vaccinated as a response to the reaction to his conspiracy buff friends. But there were other reasons, personal health, family members, etc. And then reasons against the misinformation, disinformation, or mistrust of the health system, mistrust of the pharmaceutical system. I'll draw your attention to something we heard a lot in the focus groups, and then I want to put just a side note to that. So in the focus groups, and we thought this was really interesting, we heard a lot of people say, well, I did it for the soups and the coffee. I just, it was the incentives. This is why I did it. The Department of Public Health and Environment gave us an opportunity to do another year, which is what Michael's been doing this year, after the focus groups. And he's been doing one-on-one interviews. And the reason we pitched it, so maybe sometimes in focus groups you have groupthink. Yep. And sometimes there are voices in a focus group where you hear one or two a lot, and it's hard to get everybody else to hear from them. You also, the setting was a halfway house, so it's a tough. I mean, everyone's got a little bit of the mask on. And so with these interviews that Michael's doing, he's doing 200 of formerly incarcerated individuals right now, and then 25 of the staff. Staff have asked to be interviewed. But we were looking the other day at the first 84 interviews, and we were looking at the main reason why for getting a vaccine. And guess what? That's not the reason why. What we heard was my personal health, which, yeah.
Improvement.
Definitely. From the focus groups, it switched up, the data switched up, and now we're hearing it was about personal health.
Yeah, which makes us think this is why good information from trusted messengers matters even more so for that. So just wanted to point that out for this slide.
And Carol just mentioned the messenger and the message being key. And we found a great doctor to be a part of our documentary for the informational part. His name is Dr. Michael Frank. He uses a really great analogy in understanding who our audience is. And my first time meeting Dr. Michael Frank was actually when I first got out and got Medicaid. And I have been having back issues for about 15 years, tried to get an MRI 3 times. I went to see Dr. Michael Frank, and he set me up with an MRI in the first, within 2 days. Almost broke down in tears. But he's a really great doctor, and I want you to take a look at his part in the documentary.
In my opinion, vaccination is a way that we can protect ourselves from something that the body has never seen before. So imagine you were playing for the Denver Broncos and you actually knew every single play the other team was going to run in that whole entire game. You'd like your odds of winning that, right? Things would look pretty good. That's essentially what a vaccine does for your body. It gives your body a sneak peek at what that virus looks like. So your body's immune system can make the proteins that help it fight off that infection. Of course, some people do get sick after they get the COVID-19 vaccine. They get COVID-19 a few months later or down the road. But the evidence is that getting a vaccination actually lowers your likelihood of getting really sick. So it means you're less likely to have to go to the hospital or less likely of unfortunately passing away from that infection.
So before I go to the next slide, I just want to point out, that's Michael at his desk cutting that video. He made the documentary. It's about 8 minutes long. It's on our YouTube channel. You learned all the like editing and just everything.
Yeah, and Dr. Michael Frank uses that analogy with the Denver Broncos because we're here in Colorado. But a great messenger and message for our audience.
Yeah. So we think we learned some lessons for the next pandemic. And the first is that there's nothing more important than effective communication around a pandemic, and that you've got to have information put out there in a timely way. We did hear about facilities that operated on a need-to-know basis, and you can't treat people like that. You can't treat human beings like that. You've got to let them know what you know as soon as possible through trusted messengers. You also need to educate people about what vaccines do. A lot of people do not understand what a vaccine is and how it operates.
And the trust is key. It's not built overnight. So if people aren't receiving adequate health care before a pandemic, you can't expect them to buy into vaccines and vaccinations during a pandemic. That's why we say prison health is public health. Dr. Michael Frank said the same thing, and it's really key in understanding how this population's health is related to the community on out. They're coming out, but in the case of a pandemic, we want them to adhere to the advice or the policies, guidelines from the health officials. And so that's key for us to show them that we care about them even when we're not in a pandemic.
So I just want to finish up. It's a dense slide, I know. But we wanted to take some quotes from the interviews, and we took a couple quotes from Captured Words, the chat book that Stephen's worked on. And the first one, I wanted to situate you back in that time. It hasn't been that long, but already, I think we're already forgetting what it was like to be sitting there. And I liked what this person wrote, literally, I mean, being in a mask, but I think there's a figurative aspect to what he wrote. I'm just going to stop talking so you can read, and then Michael's going to pick up next.
And so this last quote kind of takes us back to what it was like for those of us incarcerated during those lockdowns. It starts off saying, "I like to write about my cellie, James Scott. He was a good person who was always smiling and laughing. His energy was infectious. Most people, when they saw him coming, smiled automatically. He was 58 years old. When we had been in the same cell together for almost 5 years. He was my best friend. James died on Monday." So that just takes you to the realness of what people experienced during COVID-19 and the losses that was experienced.
So just to wrap up, just to remind you, our listening tour was a small qualitative sampling of experiences. But that said, we do know that the pandemic had a disproportionate impact on congregate settings such as prison. The Prison Policy Initiative estimates that mass incarceration led to 560,000 additional COVID-19 cases nationwide in just 3 months. And this relates to prison health being public health, because they also make the point that the number of new COVID-19 infections over the summer of 2020 was greater in counties and multi-county areas with larger and more concentrated incarcerated populations. It's the flow of people in and out of the prisons. It's the congregate setting. It's the confinement. So we also learned about the unnecessary suffering and a reminder that people died inside our prisons. Michael started the video. We wanted to start with that clip of people talking about the trauma because we heard a lot about trauma. We also want to wrap up with a few lessons. We hope that administrators might want to recall what we learned is the importance of providing information from trusted sources in a timely manner about the virus and vaccines, the need to mitigate the trauma of isolating people and using lockdown situations, and the need to prioritize the delivery of quality health care in our prisons today. So thank you so much.
And just real quickly, we've hit you with a lot of information. So what can you do? We've given you 5 things here. Become a learner, become a volunteer, become a neighbor, become an activist, become an advocate. It's a big system. It's daunting. It is not, however, set in stone. It's flexible. It's part of the democratic process. If you as students and practitioners of healthcare get involved, you can make a huge difference. So there's 5 ways you can get involved. If you're looking for more resources, here's just some great groups. You can go to their websites. They've all got incredible databases full of information, full of ways to become active. And with that, we'll say thank you. We wish you best wishes. We hope you all go work for justice. And with that, we'd love to engage you now in some dialogue.
Thank you all so much. We really appreciate you giving us really a crash course, right, on not only the prison industrial complex as a commercial determinant, but also public health in the context of our carceral system, which, I'm not sure that many of our students, unless they're in our health equity and criminal justice concentration, if they really consider the conditions and within our carceral systems and the impact it has on public health and how it really exacerbates a lot of issues. So I really appreciate it. I think what I'd like for you all to talk a little bit more about is, it was on that last slide about being a neighbor. One of the things that I'm really passionate about is getting people to understand the connectedness of everyone. So no matter whether or not we have an immigrant population that people are trying to get healthy, all these different populations, we're not in bubbles. And we don't just magically become healthy when we move from one city to the next. So speak a little bit more about kind of the process of reentry and how important it is to make sure people are healthy, both physically and mentally. And as a part of the public's health. And so people know how important it is to advocate for our whole population.
Thank you for that question.
Before you start, would you mind unsharing your screen so we can see your beautiful faces as we have this conversation? Thank you.
Thank you. I'll start with that. Here's what nuts and bolts. What can you do? You can talk to people about hiring people with a background. Or do it yourself if you have a business. You could talk to people about renting to people who have a background. If you work in the industry, in the reentry industry, you can also think about where your biases are. What we find in the reentry world is that a lot of people won't work with people with a sex offense conviction. And the data on the Department of Corrections in Colorado is 25% of the people have that as a need, which indicates 1/4 of our people in our prison have that. And I just this morning called 2 different organizations that I have on my website, my resource website, remerge.com, for everybody who's justice involved. It wouldn't take this person because he has a sex offense. So I called another one, got a third, got someone to take this guy. Now this is living. We're just like what Stephen's talking about. He was older and disabled. He was sitting right here at this table. And he also was in tears because he made a mistake a long time ago. and he can't get it behind him. And so this is also just being aware of where we are as a society around how we treat people who go into our prisons for sometimes crimes that we have a hard time getting our heads around. And that is, if we're going to bring them out, we have to do that. We have to be open about everything. And that means jobs and housing and the community that we give.
And I think for those individuals who are coming out, what's key and what was key for me is having that support system, having mentors or organizations that you continue to stay connected with as you come out and as you re-enter and face certain barriers. When you have that, and if you are facing hard times, those are people that you can reach out to. Those are organizations you can reach out to. And the more that people build their support systems, the more likely they are to succeed and re-enter in society. And for those on the inside, speaking of neighbors, but also speaking of the volunteers, there were many volunteers that was coming inside and bring in programs, whether it was art programs, these programs that gave individuals like me purpose and gave individuals like me meaning in their time and connecting. And as I mentioned, I spent 5 years in solitary confinement, and a big part of my getting over like social anxiety and was being a part of the theater program and just connecting with these volunteers that come in. So that is key, and that's how people can get involved. And what was really important too was the volunteers coming in and not really looking at us as the crime we committed, but just there to share their program and share those rehabilitative programs that they made available.
Did you say that was a turning point?
It was a
For
really,
you?
really big turning point for me. How to deal with that stress, how to deal with that anxiety, how to re-socialize. And so those programs are key. And shout out to those who do it on their own dime and their own time. And I think, like I say, the arts and giving people the ability to tap into their creative expression is so important. You've seen a lot of the artwork that Steven showed during his presentation and during our presentation. I think just people find meaning and purpose in being able to be a part of something like that that's bigger than themselves.
Thank you. That's so I have to just say how impressed I am with this conversation and presentation. It's really so heartwarming. Having been in public health for 30, I don't know, 30 years, and I'm only 30. I don't know how that's possible. But no, I really appreciate sort of the intersection that and the connections that you're drawing to sort of, art and really being proximate to these issues that really are important for those of us in public health who've been, coming at many of these issues from more of an epidemiological perspective and looking at the numbers and, understanding, the demographics and all of those things. But I think it's so important to draw people in, with the focus that gets us proximate. Even Michael, I know you kind of just glossed over the fact that you were in solitary confinement for 5 years. And I just want to pause on that because one day in solitary confinement is inhumane, and recognizing the impact that that has on you and those around you, and sort of the even the the universal impact of something like that people think that that's okay. um we have to pause and understand the impacts of those things. So I just really, there's so many nuggets that I'd like to lift up in this conversation, but I do want to allow our students and other guests to ask questions. But just had to say how much I appreciate you drawing those connections and looking at the intersections of sort of the more humanity, that piece, and being proximate to these issues and how important that is to bring people in.
Well, thank you again. I want to get to a few of the questions that are have surfaced in the chat, and I'm reading through them. With the recent political shift at the federal level, do you anticipate a return to the privatization of prisons? And actually, to my knowledge, I wasn't sure that, kind of educate us on kind of the private versus federal and public. Yeah, because to my knowledge, there are plenty of private prisons or privately sponsored prisons currently.
All right, I'll tackle that one. First thing to know is that, Trump obviously is a madman and we have no idea what he'll do, right? He has no idea what he'll do. He has no policies like right-wing extremists before him, like Benito Mussolini, for example. The entire effect of Trumpism is about emotion, anger, alienation. So he doesn't have a policy. He doesn't have a set thinking about incarceration, about the prison industrial complex. So we don't know what Trump will do to any of the things we've talked about today. It's a complete mystery. It's a complete wild card. But what we do know is that we're probably not going to see an increase in the privatization of incarceration. And the reason being, there was a time, in the 90s, and everyone was talking about private prisons. The fact is, private prisons, it's really hard to make money on prisons. The thinking initially was that private prisons would produce things that could be sold on the market and you could make money that way. But obviously, people forced to do labor at slave wages in prisons are not motivated workers. They're not motivated employees. So private prisons really don't work if your interest is making money. So I don't think we need to worry about that. I think the larger question is, will Trump and his nut job cabinet cancel federal Pell Grants for all of the incarcerated learners who are now getting educations in America? Will they cancel the funding that goes to the arts programs, like Michael talked about, how DU Pi saved his life? What are we going to do as activists if that funding stream dries up? So we really don't know what Trump's going to do. Could be a nightmare, could be status quo, we don't know. But in either case, I don't think we'll see a return to massive privatization.
As a follow-up to that, because there's a question in the queue related to arts as a way to help people, I guess, really change their identity once incarcerated. Can you speak to a little bit more about what you think the role is? So if this is taken out, kind of these programs are taken out, I think it's important for us to be able to say, this is the role that education and arts play in the process. So what role do you think these programs have in the process of rehabilitation or reinventing one's identity outside of kind of your location?
I think they play a major part. When you talk about part of the prison sentence, it is rehabilitation, right? So what type of programs are we providing? Restorative justice was also a major part in my transformation. I did the victim offender dialogue with my victim, Jason. They now call it a high impact dialogue. But moving from that punitive system to the restorative system, I think when you're talking about these programs and like the arts or the restorative justice programs, they're key in giving individuals purpose. But I think what was also really big for the Denver University Prison Arts Initiative was individuals like myself being able to create something and being able to share that, not just with other incarcerated folks inside, but also with our families on the outside. The plays that we did, which was One Flew Over the Cuckoo's Nest. Another one was If Light Closed His Eyes. And the podcast was us being able to create these this art and the podcast storytelling. And I think that has an impact on those involved in the art, but also those incarcerated, as well as those on the outside who can come and witness this art, but also hear it in these different mediums.
I got to jump on that, Michael, because you mentioned families.
Mm.
And I want to give a shout out to all of our students here in Colorado. We got a good thing going. We got arts programming, we got college in prison. We're really trying hard to change the system. And one of my favorite students, a guy named Manuel Cisneros, Manuel has written an incredible story about how he never had any relationship with his father. And I think this is true of a lot of folks who end up behind bars, right? There aren't a whole lot of good fathers behind folks going to prison. And Manuel has talked about how learning how to write poetry and how to do theater, how to communicate, how to open up, how to not repress emotions, but communicate emotions, it's made him a better person. But Manuel's also been very explicit to say it's made him a better father. And he's got this beautiful essay in our last magazine saying how it's poetry that helped him learn how to be a better dad. And so I think that's a key to we need when we talk about public health or the arts or education or getting people safe transitions, families are a big part of it. And a lot of that's about getting past family silence, getting past family embarrassment, getting past family trauma. And that's where the poetry, the arts, that's where that really helps us all be better communicators.
And I think it's about being humane, right? About the people who are inside, but it's also about who do we want to return to our communities and our society. So that's what we're investing in and believing in that redemptive value in everybody that's inside, regardless of what their minimum says, their sentence says. I had 98 years, and so you just never know. And so I think it's important for us to invest, and it's a ripple effect even for those who the paper might say they're not coming home, they have an impact on the short timers. We all have an impact on each other and the environments we live in and the communities we have and those who are coming home. So
Thank you so much.
And just to follow up, just put a pin in what you're saying, Michael. I mean, that's sort of the mission of our health equity and criminal justice concentration is recognizing that mass incarceration in its, globally impacts not only the individual, but it impacts the communities that the individuals come from and their families. And, in terms of unpacking that trauma, it's starts with the individual, but the families and those communities who have missed out on these individuals and whatever those contributions could have been for 1 year or 25 years in your case. So thank you for bringing that up to our attention as well.
Well, I'll dive into the next question. So how does the idea of the prison industrial complex as a commercial determinant connect with the school to prison pipeline that we see so often with our Black and brown boys, and how can we interrupt this? So I think it's one thing to talk about, you had that the slide that had the wheel, kind of all the components there, but we still kind of highlight and we think about when we watch these crime shows, adults. Some of them show children, but they never show kind of that process of constantly pushing a certain segment of our population towards the system, the carceral system.
That's a fantastic question, and the answer could be almost infinite. I'll go at it just from the perspective of a college professor to say that what we're trying to do here is to bring college courses into prisons with the intention of folks getting degrees while they're inside, or if they get released, bringing them to campus so they can finish their degrees while they're on campus. And so Deirdre used the phrase, the schools to prison pipeline. What we're doing in Colorado is we're creating a prisons to school pipeline. And this is happening all across the state. University of Colorado, Trinidad State, Adams State, Regis, you mentioned DU. So all across America, we're seeing this moment of educators realizing we need to educate everyone, not just the rich white kids. We need to educate everyone to create a prisons to school pipeline to reverse that legacy of trauma. But Deirdre, as you mentioned it, we can do what we do as college professors, but it has to begin at the elementary school, right? We've got to stop putting these kids in special classes. We've got to stop having zero tolerance policies. I really recommend a great book, Right to Punish, which kind of diagnoses how the New York City school system fell into this trap of what they call zero tolerance, which is really just institutionalized racism. And so we've got to have these conversations about racial bias, educational practices, what does school discipline look like, all of that in turn impacted by family dynamics. So as a college professor, I enter the system, I'm working with folks who've already had 20 years of neglect, 20 years of damage, 20 years of systematic bias. So it's going to require all of us, public health, college teachers, high school teachers, elementary school teachers, folks in the community, folks on the street. But as I said in one of the slides, that's the new civil rights agenda. I mean, it's all of us working together to make the promise of the civil rights movement a possibility. And when you think of it in those terms, that makes it sound kind of exciting, right? That we're not just lonely activists banging our head against the wall. No, we're the new civil rights movement, and that's our obligation.
And I think for myself, on a personal note, I'm just gonna say diversion, right? For me, I was literally on paper or supervision for 35 years. So I was on probation since I had been on probation since I was 10 years old. Um, and Stephen just mentioned being trapped, right? That's what I felt like as a kid, being trapped in the system. And so I think diversion programs, restorative justice programs are so important when you're talking about our youth and providing the opportunity for them besides the pipeline, the prison.
I mean, and I appreciate your vulnerability and sharing that. I have a 9-year-old, so I cannot even imagine, my son feeling that way. So I appreciate you. I do have the question, and this is, I guess, for all of the private institutions. I mean, University of Colorado sounds wonderful. Sounds wonderful what you all are doing, in the state of Colorado. But what can we do to spread these kinds of policies nationwide at other schools that still have the checkbox on the college application of whether or not you've been incarcerated, whether or not, I mean, that there's still a checkbox there, and how that is acted upon, I guess, depends on the school. But it affects financial aid. I mean, it goes much deeper. And so there has to be some, systems in place. I mean, you can get into the school, but if you can't get federal funding, financial aid to pay the tuition, then it's a moot point. So what do you know, and I don't want to monopolize all the time that we have here, what happened, to put these policies in place? How did you all do this? Can you direct us to this information? Because I think that's a big part of what we need to share with other institutions.
I'd like to start by just pointing out, I think that it almost has I see people put policies into place, schools, employers, organizations, just because of fear. There's fear-based thinking. And you've seen it change a little bit over the last 10 years with the effort to get employers to be fair chance employers and to get, and that's taken a lot of conversations around why do you have this policy, but also the need. I mean, you need employees. And when you've got about a third of your workforce with a record, you're going to open your ears and you're going to give people second chances. I think universities are still pretty rarefied places a lot of times, and there's no one, they're just so frightened of the headline or the pushback or whatever. If someone's kid is sitting next to somebody who came out of prison and whatever their record was, that you're not having a really thoughtful conversation around a policy that an institution is putting in place. Doesn't seem to really touch people sometimes unless it's their son or their family member that goes into prison and tells them what happened. And then they see, my kid is not a monster. My kid made a mistake. but it doesn't happen, I don't think, enough in higher education in those people who are making those policies. I just really wanted to
No, that's
jump in
great.
first.
I do want to give a shout out to all you California people. You know, you've got Mount Tamalpais College there on the shores of the bay at San Quentin Prison. They're doing really good work. Uh, my colleagues at Cal State LA are doing amazing work. So California's got a lot of good schools doing good work. So for those of you who are doing your public health, if you want to get involved, there are good schools out there you can partner with.
And I think I'm gonna give a shout out to as well. So to Dr. Ashley Hamilton and former director of Colorado Prisons, Dean Williams, who really provided these opportunities and didn't believe in the status quo of a punitive system. And so, we have to provide opportunities for people to do something better with their time, to better themselves. Education is key. Education is key to allowing a person to lift themselves up out of whatever circumstances that they may have found themselves in, to go to prison. And so providing opportunities, and that was key for my time, right? My clemency process was 5 years, but for about a good 8 years, Colorado Department of Corrections did make it possible for us to have these type of programs and for me to be involved in these programs. And what these programs really did for me was allow the people in the community who do this work to really get to know me besides the crime or what the paper said about me, the Colorado Department of Prisons paper said about me when I first came to prison, because I was 19 when I was arrested, went to prison at 21 with a 98-year sentence, and had a lot of despair. So my initial prison record wasn't a role model prison record, right? Um, but if we provide opportunities for people, people can turn it around, and they can contribute to society in a positive way.
Uh, yeah, no, we certainly appreciate sort of that being your journey, and this is really sort of lessons learned for those that want to reach out and those that do want to help. And one of the comments that you all talked about that was really important for us to kind of highlight is the importance of disinformation and misinformation. Like in public health, of course, right now we're all more concerned about that than ever before. And of course, the COVID pandemic was certainly a good example of what those challenges were. And it's really interesting. We actually did a similar study at Touro with our colleague Corinne Brody on vaccine hesitancy, and we'd love to share those results with you all that are pretty fascinating. And I think one of the interesting outcomes from that study was recognizing the importance. I think you said how important that messenger was, or that message is, that there was no recognition from public health that people were concerned about the historical tragedies of public health. We didn't. That wasn't discussed. That there was no recognition that medicine was evolving at the time, and all of those things that people need to understand from more of a perspective of humility, that this was an evolving process. And so those were some of the results that actually came out of the study that was done here in Vallejo, and we'd love to share those results with you. And I'm just wondering, sort of, what are your next steps? I understand it was a small qualitative study. Are you sharing that information with bigger health systems? What are you all going to do with that information, or is that something you've thought about? So I think
So,
it's
so Yeah, so we are in the second year, and as Carol mentioned, the second year we included staff. So we're doing 200 one-on-one interviews with formerly incarcerated and 25 with staff. And we are sharing that what we find with the Colorado Department of Public Health and Environment. And our goal, like we say, is to inform future policy, especially when you're talking about policies in these congregate settings. We have to think about it when we talk about trust and the misinformation. Those incarcerated, they're starting at basically a net zero as far as trusting medical staff and trusting administration, because prison systems, healthcare is not set up to provide preventive care or provide adequate care. It's set up more in a response to health or disease. And I think, the COVID-19 tour that we had just really highlighted that. And so people were already of the mindset of not believing that the staff had their best interests at heart. So we are going to share that information.
He was a presenter at the Public Health in the Rockies Conference last fall
Yes.
on reaching vulnerable populations. Co-presenter with a woman. It was a really cool presentation because we were both funded by this COVID-19 dollars, but she was doing teenagers in rural Colorado. And we did a presentation together, but it came together. We found themes on the both vulnerable populations and like the messenger matters, the media matters, like you just several. But oh, and Michael's video, we're trying to get part of it, and that's the main educational part, into the parole offices. They've got camera, televisions up with stuff on all the time. We want that video in, and also inside the prisons. If we can just get the educational part, pieces to what he's done inside, back inside the prison, we'll be really happy with that too.
And hopefully we can just move the needle just a little bit. What we learned from the focus groups is that people being able to share their experience, I think, allowed them to open up to be able to listen to other people, but also be able to take in the information that we were sharing with them.
Talk about that, because a lot of them said thank you
Yeah,
at
and
the end just for listening.
yeah, so just being able to be heard. And so like the focus groups were, first part we were just listening, and other people in the group were listening and being able to share their stories. And then the second part was that educational piece. And a lot of people they thanked us at the end, but they were more open to listening to the information that we was providing them, which we think is key. And we want to be able to move that needle as much as possible. So just providing people opportunity to share their experiences and why they feel the way that they feel was key.
Mhm.
We really appreciate all of you for sharing your experience, your knowledge, your research project, and really opening our eyes and really our students to kind of give our students some, opportunities to make change in their clinical and professional lives moving forward. And then, of course, our community members who have participated in tonight's evening as well. So with that, we'd like to conclude this evening's presentation. This is the final presentation of our 10th year of social justice and public health. We really appreciate you all sticking with us for the past 10 years. There are a few that have been with us from the beginning, and we really hope to see you all in the future.
Yeah, thank you. It's been a
Thank you so much.
great conversation, and we will certainly share our resources with you as well, and hope we can stay in contact. And I want to appreciate this panel and this discussion this evening. Thank you so much. Continue all of your wonderful work.
Thank
Thank
you
you
for
so
having
much.
us. It's
Thank
been an
you.
honor.
Yes, it has. Thank you.
Good
All right.
night.
Good night.